Elaine Gonzalez, Community Educator at the Breast Cancer Resource Center. We are honored to have with us today licensed psychologist Dr. Mischca Scales. Dr. Scales has practiced in a variety of clinical settings and served as a consultant to state agencies. She earned her doctoral degree at the University of Alabama and completed an internship and postdoctoral program at Duke University Medical Center. She currently manages an independent practice here in Austin, Texas. Thank you, Dr. Scales, for joining us today.
Thank you, Elaine. Thanks for inviting me.
I'm so glad to have you. So today we will be discussing how to recognize if mental health treatment is right for you. So Dr. Scales, a cancer diagnosis is life-changing. Is it common for someone to need mental health treatment?
That's a great question, Elaine. It's not unusual to need mental health treatment, counseling, or psychotherapy during times of high stress and uncertainty, especially following a cancer diagnosis. In those situations, it can be especially helpful during the transition period prior to starting treatment and after completing treatment. Counseling or psychotherapy can help with overwhelming feelings and help decrease the stress related to receiving such a life-changing diagnosis.
So both counseling and therapy are terms used to describe mental health treatment. And I used all of those terms in your prior statement. Is there a difference between counseling and therapy?
Yeah, those terms tend to be used interchangeably to refer to treatment via verbal communication that provides a safe space to talk and helps individuals and or groups understand feelings and problems. So there is similarity in that counselors and therapists work with individuals or groups to develop a safe and therapeutic relationship. Treatment has been demonstrated to be effective for adults and for children. And treatment can also employ a range of techniques. And the overall goal is improving quality of life. So the differences that may be most notable to the general public may be each provider's degree or the letters that follow their names. Counselors and psychotherapists have at least a master's degree. They all require a license to practice, and they maintain their license through continuing education. They may have some areas of specialization, for instance, evaluating and diagnosing certain disorders, treating certain concerns or issues, and or providing particular therapy techniques,
Wonderful, great. So now that I understand the differences, how would I know, what are the signs someone would need to be aware of to know when it's time to seek out professional mental health treatment?
Great question. It may be time to consider seeking professional help when you're facing really difficult life situations, and particularly if you're feeling overwhelmed in the midst of that. If you're feeling unable to cope, feeling unmotivated, experiencing constant sadness, irritability, or worry, and especially if you're having thoughts of not wanting to be in the world or specific plans about how you might end your life, suicidal thoughts.
So now I know that maybe I need to seek out treatment, or, someone with cancer has realized that maybe they've fallen, have some of these situations in their life. So, but what keeps someone from actually seeking out mental health treatment?
That's a really good question. Some of the most common reasons that individuals don't seek treatment are stigma, or pervasive negative attitudes about mental health. These kinds of attitudes can result in fear and avoidance, just an overall desire to distance oneself from the problems that you're experiencing and even care for those problems. Cost of care is a very common concern, in addition to access to care issues. Also, sometimes it's not really obvious that what you're feeling is out of the ordinary. So then an individual doesn't perceive a need to seek treatment if they don't think there's a problem. And unfortunately, some individuals are symptomatic for years before finally seeking care.
I'm going to switch our line of questioning a little bit. So I know that some women use medications for anxiety and depression, or some women have believe that that is necessary when going through treatment. So is the medication necessary to actually get into or receive mental health treatment? And then a follow-up to that is, if someone is taking medication, will it be long-term, or is it just for a period of time while going through a traumatic event?
Excellent question. Medication may be the right choice for you if your symptoms are interfering with your daily functioning. And that's something that you can discuss with your healthcare provider. You may want to consider it, though, if you're having problems fulfilling your responsibilities, whether they be at home, at work, or if you're in school. You're having trouble fulfilling those daily responsibilities. Now, medication may manage some of the symptoms that you're experiencing. However, it won't change the specific issues that are contributing to your symptoms. The thought of needing to take a medicine for a long time is and can be a very scary thought for a lot of individuals. But after your symptoms are well controlled, and especially if you've been able to develop some coping strategies to address the issues that contributed to the symptoms development, at that time, then you and your prescriber can agree and make a plan to stop the medication.
Okay. So if, is there a specific provider to discuss medication to help with depression or anxiety, or who can prescribe these medications?
You can discuss medication to help with depression, anxiety, or other mental health issues with your primary care provider. Now, some primary care providers are very comfortable with prescribing some medication and managing that medication over time. Some others may not be as comfortable and may refer you to another provider. Providers who have the most experience and training with mental health medications are psychiatrists and advanced practice nurses. So psychiatrists are medical doctors who completed additional training in psychiatry after completing medical school. There are also nurses who do additional training in psychiatric care, and they're referred to as advanced practice nurses or psychiatric nurses, and they are also licensed to prescribe.
So I want to end with a couple of questions regarding mental health providers and treatment specialties. Is there a specific training for working with cancer patients? And are there specialized mental health providers for working with those diagnosed with cancer? Or can someone with cancer see any mental health provider?
Great question. There may be providers who have had training in healthcare settings or maybe pursued continuing education that's focused on specific health conditions. And then as a result, they choose to focus their work on seeing individuals with health conditions like cancer. In general, all mental health providers can help if you're coping or wanting to learn ways to cope with those feelings of uncertainty, dealing with those transitions related to your treatment. And they can also help you talk to family or friends about your diagnosis.
Okay. And lastly, the search engines such as Psychology Today allow you to search for types of therapy. Does someone seeking out mental health treatment need to know the type of therapy they need? And should they be looking for something specific, let's say in the area of trauma?
Another great question. For that one, I would say acknowledging the need for help is a big step for many. And one of the primary contributors to a successful course of treatment in therapy is your relationship with your provider. So if you happen to know the type of therapy that you want, then that's great. But if not, it may be more useful to search based on the specific concerns that are leading you into treatment.
Wonderful. Thank you. This has been so informative. Before we end, do you have any final thoughts to share with someone considering mental health treatment?
Final thoughts. My final thoughts would be to definitely investigate treatment as an option, particularly when you're going through a really significant life event like a major illness or a significant diagnosis like cancer. Therapists, counselors can be very helpful in providing some guidance, in being a kind of helpful ear. In some situations, you may not feel that family or friends fully understand what you're experiencing or going through. And we can also be of benefit and support to family members, children, spouses that are, not maybe directly experiencing the treatment, but are maybe suffering in watching you suffer through receiving the diagnosis and experiencing the treatments.
So it can be family, for the whole family, beneficial.
Yes, it can be helpful for the entire family.
Great. Thank you, Dr. Scales, for joining me today. We appreciate your time and commitment to the BCRC mission, and I'm just so grateful you joined me today.
Well, thank you. I am glad to help and be a part of the BCRC mission.